Hello and welcome to my channel. In this video we will be looking at AQA Alevel Psychology 2023 Paper 1 Exemplar Answers for Psychopathology, which you need to know for AQA Alevel Psychology. I hope you enjoy this video and find it helpful. Let's get started. Please note that these answers have been produced with knowledge of the mark scheme but have not been approved by the mark scheme themselves. There are 3 assessment objectives, AOs, in psychology. In this video they are color-coded. AO1 Knowledge, purple. AO2 Application, blue. AO3 Evaluation, red and green. Dave wants to achieve what he thinks of as the perfect body and will often visit the gym up to 3 times a day. He finds it difficult to concentrate in the office as he is constantly thinking about his next workout. Even though his friends tell him he looks great, Dave worries his body shape is inferior compared to the other men at the gym. Question 1. Briefly outline the deviation from ideal mental health definition of abnormality. Refer to Dave in your answer. 4 marks. Deviation from ideal mental health is defined as behavior which fails to meet a particular prescribed criteria for psychological normality, well-being, and good mental health. Jehoda, 1958, proposed 6 criteria of optimal living for ideal mental health, with an absence of these characteristics indicating an individual to be abnormal. The criteria includes an accurate perception of reality, being realistic and objective about oneself and the external world, ability to cope with stress, being able to effectively deal with the challenges of life without excessive stress, environmental mastery, the ability to successfully navigate work, social, and other situations, self-actualization, achieving personal growth and progress, realizing one's potential, positive attitude towards oneself, being happy with who you are and having self-respect and self-esteem, autonomy, being independent, self-reliant, and able to make decisions for yourself. The more criteria someone fails to meet, the more abnormal they are. Dave's difficulty concentrating at work may affect his ability to reach his potential and self-actualize. Dave does not share his friend's view, which suggests his perception of reality and the way he views himself may not be accurate. Dave is experiencing anxiety, which suggests he does not easily cope with stress. Dave does not seem to have a positive view of self, e.g. about his body shape. Question 2. Another way of defining abnormality is failure to function adequately. Evaluate the failure to function adequately definition of abnormality. 5 marks. A limitation of failure to function adequately as a definition of abnormality is that some behaviors considered maladaptive are not necessarily indicative of psychological abnormality or mental illness. For instance, smoking is widely recognized as a harmful behavior that can lead to serious health issues, yet many individuals who smoke are able to maintain their daily lives and responsibilities effectively. This raises questions about the validity of using dysfunction as a primary measure of abnormality. Moreover, the definition can sometimes pathologize behaviors that are socially accepted or culturally normative. For example, certain coping mechanisms, even if they seem maladaptive, may be employed by individuals to navigate stress or trauma without indicating a deeper psychological disorder. This is a limitation because it suggests that the definition of failure to function adequately may not account for the full range of human experiences. It implies that any behavior deemed maladaptive automatically indicates psychological abnormality, which isn't always the case. For example, behaviors like smoking can be harmful but don't necessarily reflect a mental illness, as many individuals can still function well in their daily lives. This raises concerns about the effectiveness of using dysfunction as the sole criterion for determining abnormality, as it can overlook the complexities and nuances of individual circumstances and coping strategies. A limitation of failure to function adequately as a definition of abnormality is that some people appear to function adequately despite being seriously ill. Abnormality may not always be followed by observable dysfunctional traits. For example, Harold Shipman, an English doctor who murdered over 200 of his patients, was clearly abnormal and a psychopath, but he displayed no signs of dysfunctional behavior or inability to function. This highlights a crucial flaw in the definition. It may fail to identify individuals who are dangerous or have severe psychological issues but manage to maintain a facade of normalcy in their daily lives. Psychopathy is a particularly insidious personality disorder, as it is characterized by manipulative behavior, lack of empathy, and antisocial tendencies, yet individuals with this disorder can often appear charming and fully functional. This is a limitation because it suggests that the definition of abnormality may not adequately capture the full spectrum of mental health issues. Individuals who function adequately despite serious underlying conditions can easily go unnoticed, leading to a lack of necessary intervention. This oversight can have serious implications, especially when it comes to identifying individuals who may pose a risk to themselves or others, as their outward normalcy can mask their true psychological state. Patients with depression were asked to keep a daily diary of their experiences as part of their therapy. 2 researchers analyzed the same extracts from the diaries using content analysis. Question 3. What is content analysis? 1 mark. Content analysis is a method of quantifying qualitative content via coding and categorization, through a form of indirect observation that examines artifacts, communications, and form of media that people produce. Question 4. Explain one way in which the researchers could have used content analysis to analyze diary extracts in this investigation. 2 marks. One way in which the researchers could have used content analysis to analyze diary extracts in this investigation is by counting, tallying, and categorizing the number of times a word-phrase theme is used. For example, words that relate to depression in the diary extract include isolation, loneliness, sadness within the diary. The 2 researchers' analyses of the diary extracts were found to be quite different. 5. Explain how the reliability of this content analysis could be improved. 4 marks. One way the reliability of this content analysis could be improved is through inter-rater reliability. Inter-rater reliability refers to the extent to which different raters or evaluators agree in assessing a particular phenomenon, behavior, or characteristic. Multiple observers or raters are chosen to independently evaluate the same set of subjects or items. Observers use a standardized set of criteria or a scoring system to assess the subjects, e.g., devising a set of categories and agreeing upon operationalized definitions together. This helps ensure that everyone is using the same guidelines when making their evaluations. Each observer independently rates the same subjects. For instance, they might score behaviors on a scale from 1 to 5 based on their observations. Once the ratings are collected, researchers analyze the data to determine how much agreement there is between the observers. This can be done using various statistical methods including Cohen's kappa, measures agreement between 2 raters while accounting for the possibility of agreement occurring by chance, and intraclass correlation coefficient, ICC, used when there are more than 2 raters and assesses the consistency of ratings across multiple observers. The results will yield a reliability score. A score close to 1 indicates high agreement, good reliability, while a score closer to 0 indicates low agreement, poor reliability. One of the diaries included the following extract: "Managed to drag myself out of the house yesterday but wished I hadn't. Went to the shop but dropped my change at the till. Everybody knew I was useless. Why can I not do anything right? No one else I know does such stupid things." Question 6. Ellis proposed an ABC model of depression. Outline and evaluate the ABC model of depression. Refer to this diary extract in your answer. 8 marks. Ellis Rational Emotive Behavior Therapy, REBT, introduced CBT and expanded his ABC model of depression to the AQA model, including dispute, effect, and feelings. The therapist disputes irrational beliefs with effective ones, using logical, empirical, or pragmatic disputing techniques. The treatment is usually short, between 16 and 20 sessions, with techniques like challenging irrational thoughts and behavioral activation. Challenging automatic negative thoughts helps patients link thinking to emotions and record emotionally arousing events. They challenge negative thoughts with more positive ones, questioning logic, evidence, and pragmatism. This objective thinking replaces dysfunctional thoughts with constructive ones, improving emotional state. Behavioral activation links activity to positive rewards, helping alleviate depressive symptoms. Depressed people often withdraw from pleasurable activities. The therapist helps patients identify enjoyable activities and challenge negative thoughts to encourage activity. Shame-attacking exercises intentionally provoke shame in a controlled way, allowing people to challenge and change negative thoughts associated with those feelings. In the diary extract, the activating event could be considered dropping change at the till. The irrational beliefs could include, "They all knew I was useless, no one else does such stupid things." The consequences of these beliefs could include a continued cycle of depression, e.g., "I'll never leave the house again." A limitation of cognitive treatments of depression is that the treatment's effectiveness can be affected by individual differences. Embling, 2002, found that CBT is an effective treatment for depression, but that it is more effective for some personality types than others. For example, individuals high in sociotrophy, e.g. people who strongly desire social acceptance, and with an external locus of control benefit less from CBT than those who are low in sociotrophy and have an internal locus of control. Embling's study also found that CBT and antidepressant drug therapy is more effective than antidepressants alone. This is a limitation because it suggests that the effectiveness of cognitive treatments, particularly CBT, can vary significantly based on individual personality traits and characteristics. A limitation of cognitive treatments of depression is that the effectiveness relies on the patient and therapist having a good quality relationship. CBT is only effective provided the therapist is well-skilled and able to form a positive and collaborative relationship with the patient. Not all therapists will be enthusiastic or as capable as one another, and this may hinder the patient's progress and make CBT ineffective for some patients. Quaiken et al., 2008, concluded in their findings that as much as 15% of the variance in outcome could be attributed to the therapist's level of competency supporting this. This is a limitation because it suggests that the effectiveness of cognitive treatments is not solely dependent on the methods used, but also significantly on the interpersonal dynamics between the patient and therapist. A limitation of cognitive treatments of depression is that they are invasive and time-consuming. CBT requires multiple sessions with a trained therapist, which can be incredibly costly, and sometimes this is unaffordable time and cost-wise, making it inappropriate. Drug therapies are cheaper and the patient only has to remember to take the drugs without sharing their intimate feelings of insecurity to a stranger, the therapist, and for this reason, CBT may be inappropriate for patients who are severely withdrawn and already struggling to engage with others. Such patients may feel overwhelmed and disappointed, which may strengthen their depressive symptoms rather than reduce them, making it ineffective and inappropriate in some cases. This is a limitation because it suggests that cognitive treatments may not be suitable for everyone due to the demands they place on the patient. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.